I think loss is probably the most universal stress-making concern of them all that's related to COVID-19, because it's not just loss of a loved one, it's loss of the life that you used to have. It's loss of your routine and way of life. And from one day to the next, childcare centers and schools were shut, and nobody had warning. And so everyone was sheltering in place. They couldn't see their family members or friends for weeks. And many families lost their source of income, and children whose parents worked from home, because who was used to taking care of their children while working from home, especially if their children were in childcare or at school. So it became very stressful for them as well. And I think a lot of us were all trying to figure out, how do I deal with this loss? Because suddenly my life is not the life that I had yesterday, which is a huge loss. So we have to be very careful of that. It's not just losing a loved one, it's losing a lifestyle, losing all of the things that we thought we understood and were dealing with, and suddenly are no longer valid.
So we were just going to start talking about situations maybe where domestic violence is happening during COVID-19.
Yeah. And actually, domestic violence is the most commonly experienced source of trauma and toxic stress in children's lives, and it affects them in a myriad of ways. The Centers for Disease Control and Prevention have reported that in homes where violence between partners occurs, there's actually a 45 to 60% chance of co-occurring child abuse. And as a result of COVID-19 and sheltering in place, and now many children no longer have the contact with the safety net they had before. Their teachers, who would see them every day and who might be and probably were the first people to notice signs of abuse or that something was off prior to COVID-19. And maybe were the only adults that these children felt would keep them safe. So it was a very important piece of children who are experiencing domestic violence. It was a very important piece of their life. And the psychological aftermath of exposure to domestic violence can include fear of harm or abandonment, excessive worry or sadness, guilt, an inability to experience empathy, habitual lying, low frustration and tolerance, emotional distancing, poor judgment, fear about the future. And now, with the issues related to COVID-19, such as job loss and financial stress in families, fear of becoming sick, exposed racial inequities, they all exacerbate the occurrence of domestic violence. It has gone up in these recent 6 months. And because a lot of the symptoms or a lot of the ways that children express what has been happening to them are very similar to trauma and COVID-19, it's hard sometimes to distinguish which children might need more support because of this. But it can be very, very serious without this safety net. It's very hard.
Absolutely. You talked a little bit about lack of resources, but
Yeah.
how else is that affecting us?
When you look at childhood adverse childhood experiences, when you look at the work that's been done with that, um, a lot of times poverty is considered one of them. However, I think it's really important to recognize that poverty doesn't guarantee trauma. But children living in poverty are at a much greater risk if there is no adult present to support and provide a sense of safety and security in a home that's dealing with constant stress, facing food shortages, housing or health issues. Um, and what we also need to remember is that some children who are living with undocumented families can be very afraid to seek the medical care they need, in addition to not having the financial resources that they need as well, or just fear of being evicted. There is a causal link between poverty and domestic violence. So poverty plays a big sort of role in the undercurrent of what children were going through prior to COVID-19, and COVID-19 has just made it much harder for them. And we need to really think about, once again, how can we support them? In some cases, children living in poverty, the only real meal they got was at school or at childcare.
And what about disasters?
It's extremely important to recognize that the impact of experiencing a disaster and the behavior changes that might occur or how hard it might have been for the child might not appear immediately. So look for changes in behavior even months, sometimes even years after a disaster. And what you can do when children have experienced disasters and they're coming back, talk about the positive things, what people have done to support one another. But we really do need to remember, and I'm sure all of you who are working with children know whether or not that child has experienced forest fires, storms, or any other natural disasters to further make their experience with COVID-19 difficult and impact the family's ability to be there for their child, which is key. Because when families are going through disasters, it's very hard for them to remember that they need to focus on their children's needs, and their child is going through it too. Because one of the things that mitigates a trauma and the experience that children are having going through something like COVID-19 is a caring, supportive adult. So if the families are having a hard time, and if you as teachers are having a hard time because you're going through all of this too, it's very, very important to remember to focus on that, because that's what will help children get through it, is that supportive, caring person.